All right, it is 10 o'clock, so we will go ahead and get started. Good morning, and thank you so much for joining us for this month's Policy Update webinar. I'm Elizabeth Killian, the Provider Relations Manager with the Office of Medicaid Policy and Planning, and I'll be walking you through the policy updates from September 5th through October 3rd, 2023. And as we go through the updates today, please hold any questions and we will address them individually at the end. Updates today will be broken into newly covered services, one COVID policy update, policy changes and policy updates, some new reimbursement changes, and some reimbursement updates, and then announcements. And just to clarify, the policy and reimbursement updates are clarifications or changes of current policies and procedures, while the changes are new items announced for this month. Let's go ahead and get started. We do only have one set of newly covered services for this month. In BT 2023-124, the IHCP announced coverage for several additional wheelchair codes. These codes were previously non-covered, and there are 43 newly covered codes, so I won't go over each and every one. The codes will be reimbursed at Medicare rates, and PA is required for each code. And additionally, the IHCP wants to remind providers to follow American Medical Association guidance and code to the maximum level of specificity. Billing unlisted or non-specific procedure codes is only appropriate when there is not a more specific code available that matches the service being provided. And failure to comply with appropriate billing practices will result in a denial. So moving on to our one COVID-specific policy update, which also includes a claim adjustment. For dates of service on or after October 12th, 2022, the IHCP will reimburse IHCP enrolled providers for the administration of the Moderna COVID bivalent booster vaccine to members ages 12 through 17. That change in the age range is what the policy change is there. Professional claims submitted with the codes in Table 1 of the bulletin with dates of service on October 12th, 2022, which have denied an error, will be reprocessed. Claims will be reprocessed if they were processed originally during the indicated time frame and previously denied an error for explanation of benefits code 4034. Service billed not compatible with the member's age. Providers should see the reprocessed claims on remittance advices beginning October 18th, 2023. And the impacted codes for this change are 91313 and 0134A. And next, we're going to discuss some policy changes. In BT 2023-80, the IHCP announced a nursing facility resident-specific reimbursement add-on for special care unit and ventilator services effective for dates of service on or after July 1st, 2023. This change does also impact hospice providers that render services at qualifying nursing facilities when the hospice provider bills for the room and board revenue codes for per diem reimbursement. BT 2023-113 addresses the impact of this change on hospice providers specifically. State plan amendment addressing the resident-specific add-ons must be approved by CMS prior to their implementation. Currently, providers will continue to be reimbursed according to the April 4th, 2023 rates, which do include any current add-ons to the per diem, until the state plan amendment has been approved and the July 1st, 2023 rates have been released. Providers will be notified in a future IHCP bulletin when the resident-specific add-ons have been approved and the reimbursement will begin. However, we do recommend that providers change their billing practices now so that claims can be appropriately reprocessed once the state plan amendment has been approved. When hospice providers bill the room and board per diem charges for services rendered at a qualifying nursing facility, They are required to bill an additional detail line with the applicable add-on revenue code of either 193 for special care unit for dementia and Alzheimer's patients, or 199 for residents using a ventilator. The additional reimbursement for special care unit residents is $12 per eligible Medicaid resident per day, and the additional reimbursement for residents using a ventilator is $80 per eligible Medicaid resident per day. I am aware that there have been some additional questions about this policy, and OMPP is planning another bulletin that is forthcoming with additional clarification, so be on the lookout for that. Our next change is updated FQHC and RHC encounter codes. Beginning October 21st, 2023, the IHCP has added some codes as valid encounter codes for our FQHCs and RHCs. These encounter codes will be retroactively effective back to January 1st, 2023. Claims for these codes with dates of service on or after January 1st that previously denied may be resubmitted. Claims submitted beyond the original 180-day filing limit must include a copy of BT 2023-119 as an attachment and must be filed within 180 days of the publication date of that bulletin, which was September 21st, 2023. Table 1 on the bulletin indicates the 11 codes that were added as encounter codes, and Table 2 of that bulletin does include some nationally deleted codes that are being removed from the list of valid FQHC and RHC encounter codes. The removed codes, the nationally deleted codes, applies retroactively to claims with dates of service on, after December 31st, 2022. However, that change does not have any impact on previously adjudicated claims. Finally, for new policy changes, the IHCP is updating and streamlining the policies for colon cancer and urine drug screenings required prior to several organ transplant procedures. Previously, some transplant procedures required a colon cancer screening if the member was over the age of 40, while others required the screening if the member was over the age of 50. The IHCP is streamlining this so that the listed transplant procedure codes in the bulletin all require a colon cancer screening if the member is over the age of 45. Additionally, previously there were multiple requirements regarding when a member was required to have a urine drug screen prior to a transplant procedure. Now, a urine drug screen is based on the physician's discretion only. And the IHCP does remind providers to check coverage and PA requirements for urine drug screen coverage in the Laboratory Services Provider Reference Module. Next, we'll move on to some policy updates, which again are clarifications or changes to previously announced policies. In multiple previous bulletins, the IHCP announced policy changes for diabetic testing supplies. This includes a preferred diabetes supply list, which was effective January 1st, 2023, and announced in BT 2022-119. And updates to HCPCS codes that includes new continuous glucose monitors and new procedure codes in BT 2022-27 and BT 2022-121. To summarize and clarify these changes, the IHCP released BT 2023-114. For continuous glucose monitors, or CGMs, and self-blood glucose monitors, or SBGMs, PA is no longer required for the products that are on the preferred diabetes supply list for dates of service on or after January 1st, 2023. However, PA is required for products that are not on the preferred diabetes supply list for dates of service on or after April 1st, 2022. PA for non-preferred products must demonstrate medical necessity in lieu of the preferred product. And finally, existing PAs for non-preferred products will be honored for the duration of the PA approval period. Some updates regarding billing for diabetes testing products and professional claims. Providers will want to review Table 1 in BT 2023-114, which lists the 6 covered diabetes testing supply codes covered by the IHCP. Professional claims for preferred and non-preferred diabetes testing supplies must include the product's 11-digit National Drug Code, or NDC, or the Unique Device Identifier, the UDI. And pharmacy providers are reminded that diabetes testing supply claims must be submitted via point of sale, including claims from pharmacies enrolled as durable medical equipment providers. Pharmacy providers should follow billing instructions in the pharmacy services module. And finally, the IHCP accepts Medicare crossover claims for diabetes test strip procedure codes with dates of service that span 90 days. For more information, providers can review the PDSL on the Optum Rx Indiana Medicaid website, which is accessible from the Pharmacy Services page of the Indiana Medicaid Provider website. PDSL-related questions for fee-for-service members should be directed to Optum Rx Clinical and Technical Help Desk, and questions regarding benefits and claims for members in HIP, Hoosier Care Connect, and Hoosier HealthWise should be directed to the managed care entity with which the member is enrolled. And last, for policy updates, the Drug Utilization Review Board established and approved PA criteria for antiviral monoclonal antibodies, DAYBUE, miscellaneous cardiac agents, and Vyjuvek. PA changes for DAYBUE apply to the fee-for-service benefit only, and these PA changes will be effective for PA requests submitted on or after November 1st, 2023. And the PA criteria is posted on the Pharmacy Prior Authorization Criteria and Forms page on the Optum Rx Indiana Medicaid website. And next, we'll move on to some new reimbursement changes. The first two listed here are related and address some long-term care changes. First, BT 2023-116 states that nursing facilities are now required to maintain calendar year, fiscal year for Medicaid cost reporting. This means that for cost reporting purposes, nursing facilities must use a January 1st through December 31st fiscal period. Cost reporting filings will be due on the last day of the 5th month after the fiscal period ends. So this means that once the nursing facilities transition to the calendar year fiscal period, the due date will be May 31st. OMPP is only requiring the specific fiscal period for Medicaid cost report filings. And the provider's fiscal year end for federal and state tax reporting or Medicare cost reporting purposes is not affected by this new requirement. OMPP understands that some nursing facility providers previously had different fiscal year periods, and the bulletin does include a table that indicates when cost reports will be due based on when previous fiscal periods ended. On a similar note, BT 2023-118 addresses additional long-term care changes that are being implemented. Beginning July 1st, 2023, OMPP is implementing revisions to the Medicaid nursing facility reimbursement calculation, the supplemental payment program, and related billing requirements. It's important to note that BT 2023-118 is not intended to be all-inclusive, and providers should review the proposed rule and the state plan amendment for additional and clarifying information. So in addition to what I just mentioned regarding the fiscal year changes, OMPP has authorized changes to due dates for requests for additional information and reconsideration. The revised due dates were previously announced in an FSSA announcement that was published on June 16th, 2023, and that announcement is linked in the bulletin. All nursing facility providers are required to submit monthly census information on the nursing facility census data collection form, also known as the census form, via the Indiana LTC cost reporting web portal. For more information on this requirement, see the FSSA announcement that was published on July 27th, 2023, which is again linked in the bulletin. And this bulletin also reviews the nursing facility additional reimbursement add-on for special care units and ventilator programs that I've already covered. So I will skip that piece here. And there has also been a change in reconsideration rights. Previously, the final cost profile provider reconsideration rights for all components of the rate calculation. Reconsideration rights will now be communicated through either an announcement, a cover letter, and/or a rate letter associated with each element that can be reconsidered. Reconsideration responses must be received within 15 days of the notification received. The bulletin also covers several system or process changes that do not have an immediate impact on providers or do not require immediate provider action. I won't go through each of those here, but again, providers should review the bulletin, the proposed rule, and the state plan amendment. Next, BT 2023-123 covers billing information and coverage for the October 2023 HCPCS code update. The information provided in the bulletin is effective for dates of service on or after October 1st, 2023. IHCP is awaiting the final posting of the CMS fee schedules affecting pricing of the procedure codes, so that information is not yet available in the bulletin. The IHCP will issue a publication detailing the coverage and pricing information after final review is complete. There are 8 tables of changes included in the bulletin, so make sure to review that information carefully. And our last new reimbursement change is the annual update of the ICD-10 codes. The changes to the ICD-10 codes are effective for dates of service on or after October 1st, 2023. Of note, 4 diagnosis codes have been added for chiropractic billing, and several codes have been added to the MCE Emergency Department auto pay list. And additionally, 4 codes have been added to the list of qualifying diagnoses for members covered by the Presumptive Eligibility for Pregnant Women benefit plan. We'll next discuss some reimbursement updates to previously announced changes. First, BT 2023-112 indicates that eligible out-of-state children's hospitals will be reimbursed for inpatient hospital services at 130% of the Medicaid reimbursement rate and the calculated Medicaid inpatient hospital outlier. And they will be reimbursed for outpatient hospital services at 130% of the Medicaid reimbursement rate provided by eligible out-of-state children's hospitals. This reimbursement is effective for dates of service from July 1st, 2023 through June 30th of 2025, pending approval from the Centers of Medicare and Medicaid Services, and applies to both fee-for-service and managed care claims for members younger than 19 years of age. The bulletin lists the enrollments of the specific out-of-state hospitals that meet the requirements to receive this reimbursement. In BT 2023-22, the IHCP announced changes to EMS transportation rates that were effective July 1st, 2023. The changes include a rate change for advanced life support, ALS, and basic life support, BLS, ground transportation, so that the services have the same rate. The codes that were impacted by this change were A0425 with the U1 modifier for ALS ground mileage, and A0425 with the modifier U2 for BLS ground mileage. After this change, providers requested that the requirement for the use of the U1 or U2 modifier be removed because the rates are now the same and distinction between ALS and BLS mileage was not necessary. Therefore, effective immediately, the IHCP no longer requires the use of the U1 or U2 modifier with code A0425. This change is retroactive to dates of service on or after July 1st, 2023. The modifiers will be considered optional or informational only. The rate for ALS and BLS transportation will remain at $8.71 per mile, whether A0425 is billed with or without the U1 or U2 modifiers. Providers that previously received a denial due to a missing modifier for mileage for dates of service on or after July 1st may resubmit the claim for reimbursement. As a reminder, modifiers for commercial or common ambulatory service and non-ambulatory service will remain U3 and U5 respectively. Providers must continue to use modifiers U3 and U5 to designate mileage for these services. And modifier SE is still required for medical review team mileage. And our last update, effective immediately, the Indiana Health Coverage Programs has updated the Durable and Home Medical Equipment Codes Provider Code Table document to reflect information that was inadvertently omitted from previous publications. Banner BR 2022-15 announced coverage of procedure codes E0986 and E2313 for dates of service May 13, 2022 and after. And BT 2021-09 announced coverage for procedure code C1825, effective for dates of service on or after January 1st, 2021. These updates have now been added to the provider code table document. And next, we will move on to just a few announcements. One thing that is quite important for providers is that one of the last provider enrollment changes remaining from the COVID public health emergency has ended. During the PHE, the IHCP removed the requirement that a rendering provider must be linked to the group enrollment in order to receive reimbursement. Effective October 1st, 2023, so just 3 days ago, this requirement is back in place. That means that after about 3 years, claims will again deny if the rendering provider on the claim is not correctly linked to the group enrollment, also on the claim. Providers will see EOB code 1010, rendering provider is not an eligible member of the billing group, or group provider number is reported as the rendering provider. Please verify and resubmit. If you see this code on claims, this new edit or reinstated edit is impacting the claims. Group practices may add or remove rendering providers through the provider maintenance section of the IHCP Provider Healthcare Portal or as part of the revalidation process. In addition to proper claims payment, rendering provider linkages are critical to ensuring that prescriptions from rendering providers are recognized for claim payment by a participating pharmacy. Prescriptions written from rendering providers that are not associated with an active group will be denied. As of October 1st, Gainwell Technologies identified 220 so-called orphaned providers or rendering providers that are enrolled with the IHCP but are not linked to any group enrollments. OMPP highly recommends that providers double check to ensure that all of their rendering providers are properly linked to the group enrollment. Next, Gainwell Technologies has recently noticed an uptick in providers attempting to contact Gainwell through means other than their provider relations consultants. Therefore, Gainwell reminds providers that their provider relations consultants should be one of their first points of contact for resolving claims questions, enrollment concerns, to receive training, or other issues. BT 2023-127 includes the provider relations consultant region map for Gainwell Technologies, including email and phone contact information. The bulletin also includes the specialty contact methods for out-of-state providers, long-term care providers, and providers who have questions about electronic visit verification. In addition to the Gainwell Technologies provider relations consultants, each MCE also has provider relations representatives that can assist with questions for that payer. Please review the quick reference guide on the provider website for links to the MCE's websites and their contact information. And finally, the IHCP is requesting feedback on the IHCP provider website. The IHCP aims to provide accurate, applicable, and easily accessible information and wants to ensure providers feel confident in locating the information they need to be successful in the program. The IHCP would like to gather providers' feedback on the usability and organization of the website. We are requesting providers to complete a survey that is available through October 31st to help gather information and improve the website. The survey is only 8 questions and should not take more than 10 minutes to complete. All responses will also be kept anonymous. I will go ahead and paste a link directly to the survey here in the chat if you want to go ahead and click on that so you can take that survey as soon as we are finished here. Or you can review BT 2023-120 at a later time to take the survey. And last but certainly not least, we want to remind you of the upcoming 2023 IHCP Works Annual Seminar. We will be back at the Indianapolis Marriott East this month with exciting sessions for providers on October 24th, 25th, and 26th. One new thing that we are doing this year is provider roundtables with specific provider types and all of the MCEs and Gainwell technologies in order to answer provider questions that are not addressed in other seminar sessions. Providers do need to register for the seminar, and I will also put that link in the chat. And for all of the details, session descriptions, and seminar schedule, providers can review BT 2023-115, and we are really excited to see all of you later this month. That does cover all of the BNRs and bulletins published from September 5th through October 3rd of this year. Here is a list of the first set of bulletins we covered today. I'll pause here to let you jot down any publication numbers you'd like to go back and review. And here are the remaining bulletins that we discussed today, if you'd like to jot those down. And I'd like to take just a couple moments to go over the resources we have available for providers and ways that you can reach out to us when you have questions. When you have questions or concerns, you can reach out to your regional field consultant, as we just mentioned previously. Each MCE in Gainwell Technologies has representatives assigned to each area of the state. They should be one of your first points of contact when you have questions. Our provider reference materials can be found on the IHCP provider website. These materials include our bulletins and provider reference modules. These three items will help you keep up to date with all of the new information coming from the IHCP. And the provider education tab on the provider website provides information on all the different trainings, webinars, seminars, and other educational opportunities available to you. If you are not yet receiving our weekly emails to introduce our provider communications, please go to the provider website and scroll down to the bottom where you'll see a box just like this. Enter your email address and you'll be signed up to receive an email each week with links and summaries of the bulletins and other provider communications. If you have reached out to the customer service teams and the regional field reps of the MCEs or Gainwell Technologies and continue to have questions, you are always welcome to reach out to the provider relations team with OMPP. We are available to you as well. You can reach us via the OMPP provider relations email address on the screen. The IHCP listens inbox is another way you can reach out to us. This inbox is specifically for us to receive feedback on our presentations, outreach, and education opportunities, and to let us know if there is a void in the information we are giving to the provider community. And if you have questions about the provider enrollment, you can always reach out to my colleagues on the enrollment side at the enrollment email address that is actually not on the screen, but I will put in the chat here momentarily. And because we do always want your feedback before we move to questions, we would also appreciate if you would take a very quick survey regarding this webinar and how we can improve the information we provide to you each month. You can scan the QR code, or I will also paste this survey in the chat. And I will go ahead and take questions now. I see that some folks have already started typing questions in the chat box. I will go through those one by one. And if I don't have the appropriate subject matter expert available right now, we will take your question back for research. We may ask you to send your question to the provider relations inbox so that we can send the answer to you when we have that ready. I do see a question from Aaron. Has there been a date in which the new rates will take place? Also, is there a date in which we'll be reimbursed proactively with the new rate? Retroactively. Aaron, can you be a bit more specific about which rates? There's a lot of rate changes going on right now, so I'm not sure if there is which types of rates you might be referring to. Okay, for attendant care services. I do not have more information on waiver rates currently. I believe that we are still waiting on CMS approval for those. As soon as we do have more information, there will absolutely be a bulletin and we will provide that information. Lacey asks, I heard Molina did not get a DSNP contract. Does that mean they will not be a Pathways MCE? The OMPP is still going through our readiness review period right now. We have not made any statements regarding the finalization of that readiness review and who will be moving forward as a Pathways MCE. Those are the only questions that I see in the chat currently. If anyone does continue to have questions, feel free to go ahead and put those in the chat. Thank you, Erin. Seeing any other questions? So I will just again remind you all, scroll up in that chat, make sure that you do, first of all, take that survey about our website. We do want to make it as user-friendly for our providers as possible and want to ensure that we have all of the information that you need to be an effective member of our program. Oh, goodness, okay, there's a he put a quite long message here. So Lacey does say not a question, but an update. Oh, on those waiver, on those rates that Erin was inquiring about. I think that does overall just summarize kind of, or gives much more specificity to what I said previously, that we are still waiting on the approval from CMS, but when it does get approved, those rates would be retroactive back to July 1st. So yes, thank you, Lacey, for providing more context there. So as I was saying, yes, please do take the survey about our website, and then also make sure that you do register for the annual seminar that is coming up in a couple of weeks. Thank you all for where can we find the actual rates? Kevin asks where they can find the attendant care rates. I am pretty sure there was a bulletin around July 1st. Let me see if I can find that quickly for you. Put two links here in the chat for you. The first one was the first bulletin that we released, BT 2023-59, that introduced those rates. And then, however, we did need to make a correction to the rates So we also published BT 2023-78 with some additional information. So Kevin, I think those two bulletins are what you'll be looking for all of, and that does list individually each of the rates for all of the services. And one last call for questions from the group. All right, I do thank you all for your time this morning, and we will be back next month with another update of all of the policies, and just maybe we'll have that answer for when those waiver rates will be effective going forward. Have a wonderful day, and again, we do hope to see all of you at our annual seminar later this month.